Hello everyone, hello my diabetes warriors. So if you haven't been following me, or if this is your first video, I've been talking about diabetes series. We have John, who is 53-year-old male with type 2 diabetes for last 5 years, and we've talked about the first few steps, the blood test evaluation, and just a peek through what insulin resistance is. So insulin resistance, that is, our cells, which we have millions of them, are resistant to the action of insulin. Now remember, we cannot survive without insulin, so it's a crucial, important hormone. When insulin enters into a cell, so imagine this is a cell, when insulin enters inside the cell, that's when the doors open for glucose, which is the fuel, the main fuel for our cells, can enter into the cell. Okay, so entry has to be positive for insulin so that glucose can enter into the cell. Now, insulin resistance is that there is resistance for this insulin molecule to enter inside the cell. What is causing the resistance? It's called intracellular fat. Fat which is inside the cell. I'm not talking about the fat which is the subcutaneous or the visceral fat, but actually intracellular fat, so inside the cell. These are tiny molecules, and they make the door for insulin very sticky. When the door is very sticky, the insulin is really trying hard to enter inside the cell, but the fat cells, intracellular fat cells, don't let it, or there has to be greater power of insulin. That means too much insulin in the blood for it to enter inside. Okay, that's why many patients with insulin resistance will have high insulin levels in their blood but normal glucose values, because their pancreas is working harder. Okay, an ideal world will be that the doors open when insulin wants to enter inside, so that when you eat or when your glucose is getting higher than usual, the doors open for glucose and glucose can also enter in. All right, so in simple terms, insulin resistance is a resistance inside the cells, and the sticky intracellular fat are causing it. So what's the root cause? The intracellular fat, you guessed it right. And this usually comes from, there is a genetic component, there is a lot to do with the caloric intake, there is a lot to do with our food intake, which is usually higher in fats, which leads to the insulin resistance, and then the diagnosis of prediabetes, diabetes. It's a very important root cause even for heart disease, for stroke, for metabolic disturbances, as well as hormonal imbalances.